Hi, I'm Gary White for Channel 6 Central Kentucky Television. I'm here with Dr. Trish Cecconi at Central Kentucky Optometric Associates for our Eye Care News segment, where you get to learn all about our eyes. And this month we're going to talk about a couple different things because we're getting ready for summer. And so that means we need to take care of our eyes, right? Because your eyes, people know about sun, putting sunscreen on their body and stuff, but your eyes could possibly get sunburned as well, right?
Absolutely, absolutely. You can have just a superficial exposure of your eye to ultraviolet light and get what's called a photokeratitis, where your eyes get very red and they get real watery, and it can be quite painful. It's basically a sunburned eye, and it feels very much like a welder's flash does, and you don't really feel it happening when it's happening, just like sunburn. And then 6 to 8 hours later, you really start to feel it. The photokeratitis you can get also from a tanning bed, so you want to make sure you wear eye protection in a tanning bed. You want to really absorb most of the UVA and UVB rays that you get exposed to. If you're on the water or on any kind of reflective surface, your exposure actually doubles or increases, and eye protection is important, UV protection is important, and you may want to polarize your lenses to get a little added glare control and protection from a polarized lens. Also want a lens that wraps around good so that you don't get a lot of exposure. So the immediate exposure can cause photokeratitis with immediate response, but also if the ultraviolet penetrates deeper into the eye, it can accelerate cataract formation and can actually increase your risk or accelerate macular degeneration.
Okay. Now, you actually have sunglasses here as well that you can get people partnered up with, right?
We do. We have plenty of choices here. We have fashion designs. We have real sport designs that have polycarbonate or protection from balls, flying objects, impact-resistant lenses. We have them in plano, and we can also prescribe or make prescription sunglasses out of many of the styles that we have. We do Oakley prescription sunglasses. We do Ray-Ban. We do the Wiley X line, and you can prescribe all those. And most of the fashion frames that we have are the fashion sunglasses. You can put your prescription in those also. So definitely, if you wear contacts, you might want to wear planos. But if you have a prescription, you may want to, upgrade your sunglasses and get your prescription put in them.
And the sunglasses are not just for the fun stuff either out there when you're putting in stuff. Because when you're gardening or cutting the grass or something.
Mowing is important to, one, give you your protection, and a wide brim hat also is a good idea when you're out in the sun. But you also need to protect yourself from flying projectiles. When you're mowing, weed eating, we see a lot of weed eating injuries. And you also want to protect, 4th of July is coming up, and the dreaded fireworks, especially the homegrown or the homemade kind. You really got to make sure that you are safe with that. Wear eye protection and be safe with your home fireworks. Another thing is campfires and throwing, I always see somebody at least once a year, they threw a soda can into a campfire. Usually I get one person a year that does that and can have very serious sight-threatening injuries from that. So you want to really protect yourself from all that stuff.
Yeah. And when you are also, if you are a gardener or out there weeding or what have you, be careful what you do with your eyes too, because some of the different things like poison ivy or whatever, if you encounter that, you could possibly get in your eye too, right?
If you're sweating and it's running and you have exposure and it runs down into your eyes, or you have it on your hands and touch your eyes, and you can get it in and around your eyes, that's important. And if you're using any kind of chemicals, pool chemicals, dangerous, they can be dangerous for your eyes. That chlorine that you put in pools, you're exposed to that. Pesticides, weed killers, those are kinds of things that you're going to come in contact with that you need to protect your eyes from. And if you do come in contact with any of those, before you even call us, flush your eyes. If you don't have anything sterile, get the hose out or put your head in the sink and flush before you even call us. Just get that stuff out of there before you call us.
Then when I was young and we were in the pool, we were told not to open our eyes in the pool because of the chlorine. Is that something of a concern once it's actually in the water with you?
Well, it's pretty diluted in the water, and it can cause, generally, hopefully it's not in a concentration where it would cause any significant damage, but certainly can cause, again, a keratitis there. So you definitely want to, and that's limit your exposure. The swim goggles are great for protecting your eyes that way. Also, if you're a contact lens wearer, it's not a good idea to wear your contact lenses in a pool or a hot tub or a green river or any other water source. If you do happen to do that, don't take them out immediately when you're done and throw them away. You just don't want to expose yourself to a fungal infection or a pseudomonas or bacterial infection, or the worst, none of those are good scenarios, but acanthamoeba, which is a protozoan that likes to stick on contact lenses. And so folks who get acanthamoeba generally have been in the water with their contact lenses. And acanthamoeba, all of those infections can be devastating. So do not ever sleep or continue to wear a contact lens that you've worn in any kind of body of water.
And we also want to talk really quickly too about tears. You know, people their eyes tear up at all different times when you look in the sun. Sometimes it will tear up. Is it a concern if they're tearing too much, or is it a concern more if they're not tearing at all? It
certainly can be. Something as benign as a seasonal allergy can cause your eyes to tear or water. Something a little more serious like a dry eye, and it's kind of an oxymoron, but when your eyes are dry, they'll send a little reflex to your lacrimal gland and send a little message to your lacrimal gland, and your eyes can water too much. They can, if you're exposed to a lot of bright light, that can cause kind of a reflex tearing there. Again, a dry eye can cause watering. Or you might have a plugged up lacrimal, nasolacrimal system that you're not draining, and so that could be cause of the tearing. Exposure to a constant irritant can cause your eyes to tear and water. So there's many different things and many different causes, but it's not normal for your eye to tear readily. So if you are, it's called epiphora when your eyes tear a lot. And if you are having that, some of these things are very treatable, and most of them are. And so if we can find the underlying cause of what's causing your tearing, we can usually help to get it resolved or minimized.
And you can kind of do a test to find out something like that here?
Yes, it really will require several different things. We test for dry eye, we test allergies, and we even have some tests that we can test the drainage system to see if your tears are draining the way that they're supposed to be. And so we can try and narrow it down and give you some relief from that, because that's not really any fun, having your eyes water and tear all the time.
Right. And if you're not tearing, that can be an issue too, because then that could prevent stuff from occurring that needs to be naturally occurring.
Well, sure. If you're not tearing, then that's a dry eye, and you're not washing toxins away, and it causes inflammation of your ocular surface. And not only is it uncomfortable, but it can be sight-threatening.
Right. So contact Central Kentucky Optometric Associates if you have any of these conditions. And I've been talking with Dr. Trish Cecconi. There are offices in both Lebanon and in Springfield. Thank you very much.
Yeah, and have a nice, fun, safe summer.
Absolutely. This has been Gary White for Channel 6 Central Kentucky Television.